Hello there everyone, I'm Joubert and I'm going to be taking us through erectile disorder, which forms part of sexual dysfunctions. So what is erectile disorder, ED? Well, it's a type of sexual dysfunction in males that's psychogenic in origin, and it shouldn't be confused with erectile dysfunction, which is actually a descriptive term used in a lot of different ways, particularly in medical ways. Well, the diagnostic criteria for ED is that the person isn't able to obtain or maintain an erection during sexual activities, as well as having decreased erectile rigidity. It persists for more than 6 months and causes significant distress or impairment to the individual, and it cannot be better explained by another non-sexual disorder or severe relationship distress or other stresses, as well as substance or medication. And now for some diagnostic considerations which psychologists might want to keep in mind. Well, in order for it to be diagnosed as ED, it should occur in the majority of the person's sexual encounters, so about every 3 out of 4 occasions. It can occur in certain conditions or in all conditions. So, for example, with different partners, different settings, places, or different types of stimulation. It'll be quite beneficial to a psychologist to have a careful sexual history of the patient, and they should also keep in mind the partner of the client and their sexual health. For example, the client might be abstaining from sexual activities if their partner has an STI, and they might also have decreased sexual desires just if the relationship actually has poor communication. Furthermore, factors such as stress, religion, or medical history are also important to take note of, as well as the client's age, because ED has a higher incidence rate in older males, and it turns out to actually be more often organic in nature. Males under 40, though, are more likely to have a psychogenic origin. It's extremely important to not just assume these ideas, though, as you may risk misdiagnosing your patients and not treating the actual underlying diseases. So now we get on to what it actually means to be someone with ED. Well, someone with ED will quite likely struggle with ideas of their own masculinity, or they may face some problems with low self-esteem or confidence. Those in relationships will often find themselves feeling guilty or quite annoyed because they're in effect letting their partner down, and they might be afraid of their partners leaving due to this. Those who are single, though, they might avoid sexual encounters or relationships with other partners due to fear of being shamed, and they might often find themselves relying on medication such as Viagra. Overall, we can spot an impaired social life and decreased quality of life. So when a professional is faced with someone who they may want to diagnose as having ED, they should consider a few things before in case of a differential diagnosis. The first thing would be to establish what normal erectile functioning actually is. Some people may have quite high expectations put on themselves that they might not be living up to. Otherwise, it's really important to distinguish between various biological causes of erectile dysfunction from psychogenic ones. After all, erectile disorder is mental in nature. You can't diagnose someone with ED if the person's cause for erectile dysfunction is purely medical, in other words. So someone with diabetes mellitus, for example. An excellent way to test the origins is through nocturnal penile tumescence testing. Essentially, a sleep study is conducted where they measure erections during one's sleep to determine if it's actually medical in nature. Furthermore, medications or substances might be at play. If the onset coincides with when the person started using the medication or substance, this can be determined. Otherwise, there might be links to non-sexual psychiatric disorders, such as the sexual aversion associated with anxiety disorder, or the hyperactive sexuality associated with major depressive disorder. A few other psychogenic indicators will include an inconsistent erectile dysfunction, or only having erectile dysfunction after psychologically stressful events. Of comorbidity. So, what other disorders will often present with ED? Well, first of all, other sexual diagnoses. So, for example, male hyperactive sexual desire disorder or early ejaculation. Also, non-sexual disorders such as with anxiety or depressive disorders. It should be noted that men with erectile disorder actually have a higher risk of depression. People with ED are often also diagnosed with infertility, and it is quite common to see it in people diagnosed with PTSD. When it comes to what causes ED, there are multiple factors. For a start, a lot of biological different factors may be present, and a lot of links to lifestyle. So, if someone's getting enough physical exercise, if they've been smoking, or also a factor of having unwanted sex. Concern regarding the size of one's genitalia or the possibility of being infertile have also been associated with this, and there is a strong genetic component present as well. A person's experience of stress as well as depression or trouble focusing, performance anxiety, all of these factors can also contribute to erectile problems. Lastly, we get to the topic of attachment theory, which essentially suggests that if parents don't provide a healthy environment for the child may struggle from ED. A study actually reported that 43.5% of men with ED in their sample group reported experiencing events that could have possibly caused disturbed attachment during their childhood. And now for the topic of gender, which is quite a simple section now because the nature of erectile disorder means that it can only apply to people who would, in normal circumstances, be able to maintain or obtain an erection as well as having erectile rigidity during sexual activities. Hence, it can only apply to males. Now on to the hot topic of cultural context. Well, first of all, the prevalence of erectile disorder differs all around the world. And this suggests that there's a possibility that cultural factors could actually play a role in erectile disorder. Some cultures view men diagnosed with ED as less masculine or maybe weak, as could be suggested by the picture at the top right of the screen. Various cultural views on gender roles also play a role in this, as well as views on fertility or marriage, not to mention sexual potency. All of these could also add specifically to the anxieties that affect ED, which can be related to the stresses mentioned earlier in this PowerPoint. ED may be linked to worries about one's penile size as well, as aforementioned. And specifically in South Africa, these factors are still applicable. It's also worth noting that in South Africa, herbal medicine is often used to treat erectile disorder instead of modern medicine. Furthermore, the actual health-seeking behavior itself for men with erectile disorder is also influenced by cultural views. Lastly, it's quite important to consider homophobic countries. For example, in Malaysia, where it's actually illegal to be homophobic. In this scenario, a homosexual man may suffer from erectile disorder because of hyposexual activity associated with not being able to practice your sexuality in a place like Malaysia. Now, onto the important topic of possible prevention strategies. Firstly, something can probably be done about the perspective on penile size and ideas of masculinity, not only within individuals but also on a social level. Secondly, something could be done for people who are suffering from stress or depression, anxiety. They may want to seek therapy if necessary, as these are all risk factors associated with ED. The topic of parental care is extremely important in this scenario, especially due to the attachment theory as mentioned previously. Furthermore, people should try to encourage healthy relationships with their partners and should try to stick to sleeping with partners that they know if they do suffer from ED. People should take various measures to avoid getting medical problems, so exercise would probably be quite a good idea, and the avoidance of drugs and alcohol would also be beneficial in this pursuit. Now to round off with the final topic of the impact that ED has on family and loved ones. A satisfying sex life is an important part of building an intimate relationship. Partners of those with ED may withdraw their intimacy due to confusion. Some of them may worry that their partner is losing interest or is having an affair. Partners in heterosexual relationships are also more likely to present with female sexual dysfunctions. They may have decreased sexual arousal, desires, or orgasms during coitus. Partners may often feel rejected, unattractive, or frustrated, and will often report a general decreased quality of life. Those suffering with ED suggest that their partner's understanding and support is key to them maintaining a healthy relationship. However, most report their partner's reactions to be negative. If the struggling partner decides to leave the relationship, after already creating a family, however, this could cause negative effects to the other family members as well, as a broken home may be created. I've been Louis Joubert, and thank you very much for listening to my presentation.